You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you so much for joining me. You're listening to the Dental Zone. I am a dentist with over 30 years experience. I graduated in 1992 and have been working holistically since 2001. My philosophy is that dentistry should be part of your health and well-being, and that the techniques and materials that we use should not have detrimental impact on your body. I like to explore the link between overall health and your dental health and vice versa, and support people to understand that link and what they can do to have great oral and dental health and a beautiful smile that supports them to be healthy and fit for life. In this show, I share information on dental amalgam, mercury, fluoride, gum disease, and much, much more. So let's get in the zone because I've got lots for you. And tonight I am going to be talking about dental amalgam and mercury, and I'm going to share with you 10 facts you need to know about dental amalgam and mercury. It's been a real passion of mine to educate people about health and well-being and how their oral health plays a big part in their systemic and overall well-being. And as holistic dentists, there are things that we do a little bit differently to conventional dentists. So we're very much about why you're having problems, what's causing your tooth decay, are there nutritional and lifestyle things going on that we can address beyond brush, floss, and don't eat sugar. I also believe that we shouldn't be putting anything that's potentially toxic or harming into our patients' mouths. So that includes dental amalgam and fluoride. 10 facts you need to know about amalgam and mercury. So why is mercury such a hot topic? Why is dental amalgam of concern? Surely they're just those silver fillings that dentists put in your back teeth. Well, mercury is toxic to humans, and dental amalgam fillings use 50% mercury combined with other metals like silver. And amalgam fillings are considered to be one of the most common sources of mercury exposure. You know, research shows that mercury can cause damage to human tissue and brain function. And this is why, this is one of the reasons that I advocate stopping the use of dental amalgam. It should just be completely discontinued. And if you have them in your mouth, I'm very, very pro having them safely removed. Now, in countries like the UK, from the 1st of July this year, dental amalgam will be put under limited usage, and that means it can't be used in children, it can't be used in pregnant or breastfeeding women, it can't be used in people who have got poor health and also the elderly. And this is because of concerns about mercury content. New Zealand have just done the same, and it's about time that Australia followed suit and that dentistry actually drew a line under the use of amalgam mercury fillings and just said no completely. The next thing that needs to happen is that we stop using them as a profession, but also that we learn and understand about safe removal. Because when you drill those fillings, the mercury that's held within them gets released. But it's not just when you drill them. That mercury is seeping out of those fillings daily. Anything that creates any heat or friction on the filling, hot drinks, hot meals, brushing, chewing, clenching and grinding, acidic drinks, chewing gum, even swallowing releases mercury vapor from those fillings. The dental profession admits this. They say, yes, we know that happens, but, and here's the but, they reckon it's in such a tiny amount, it's not significant. Well, if it was a tiny amount, just as maybe once or twice, we could say perhaps it's insignificant, but it's not. It's happening all the time. And mercury accumulates in our bodies. It's quite hard for us to excrete. So I'm going to give you the following 10 facts. I'm going to expose some issues related to dental mercury amalgam and There's a lot of research out there. This isn't just me saying it. There's a lot of scientific evidence and bodies of science that are saying the same thing. So number one, I've just touched upon this, mercury fillings leak. You get exposure to mercury from the fillings, from erosion of the filling, from wear and tear, from evaporation of the mercury as a vapor from the surface. In one study, they used a variety of X-ray imaging techniques, and they examined the movement of mercury through the tooth. They found mercury in the tooth several millimeters away from the site of the filling, and this shows that the mercury is actually moving through the tooth structure. They also found higher concentrations of mercury in the area around the tooth, so the area that connects with the gum, and that suggests that there's direct exposure into the bloodstream. They also found mercury in tartar, the stuff that builds up on your teeth and needs clearing away. So these studies show that the mercury doesn't actually remain in the filling, but seeps and leaches out into the surrounding tooth structures. Fact number two, removing amalgam fillings requires caution. So why is that? So when you drill amalgam, when you drill any tooth, even though we've got cold air and water, the drills are going very, very fast, and that creates a certain amount of friction. That friction releases mercury vapor because it's getting warm, but also what's happening, there's this fine particulate of amalgam dust that goes up into the air, and that contains a lot of mercury, and those particles can be breathed in, they can be absorbed directly through the internal parts of the mouth, they're landing on clothes and skin and contaminating you. So it's really important to apply proper preparation for you as the patient about to undergo having those amalgam fillings drilled out, and to use proper safety protocols and support your body before and after the removal of the filling. So we want to minimize any exposure during that process, and we want to ensure that the amalgam is completely removed, that there's no little bits left behind. And the goal is to prevent any exposure and any absorption of mercury during the process. So this process has a name, it's called SMART. And SMART stands for Safe Mercury Amalgam Removal Technique. Holistic dentists are starting to get certified under the International Academy of Oral Medicine and Toxicology so that they can say, hey, I'm a SMART certified dentist, I'm going to remove these fillings safely using all the strict and latest protocol. Number three, mercury is immediately toxic to your body. It's not something that sits there, then a slow release and it has an effect a little bit later. It enters the body through ingestion, so eating it goes into the bloodstream, and you can also inhale it. Once it's in your body, it gets very quickly absorbed and distributed into your major organs. It really specifically goes to the brain. The brain is high in fat and sulfur, and mercury loves binding to that. It also goes to the kidneys, and these are the areas that are going to suffer the greatest amount of damage. And the damage doesn't take a long time to develop. What I'm saying is damage is occurring instantaneously. Now, a study of children aged 8 to 18 observed that there was kidney damage in children with mercury amalgam exposure. They found chemical indicators of kidney damage in the urine. So this happens straight away. It's not something that's taking 50, 60, 70 years, and you might, outlive the effects if you're lucky. I used to have a patient who was a geneticist, and they were very interested in DNA. And he said to me, if we want to damage DNA, we just expose it to mercury and boom, it's damaged, and we get the results that we're looking for. So that, is quite telling. Fact number 4, now this is a bit controversial, and I'm not saying that this is the case or it's something that I irrefutably believe, but there have been studies that show mercury may be linked to autism. It has a horrible effect on the brain, and it's been known for centuries that mercury exposure during the developmental stages of birth and early growth has been linked to mental disorders, and it's now been shown that this could potentially be linked to autism spectrum disorder. One study found that women with 6 or more amalgam fillings were 3 times more likely to have children with severe autism compared to those with 5 fillings or less. So obviously there's something going on there. Whether the mercury is, a causative factor or a contributing factor, it's hard to say. But essentially, if you've got amalgam fillings, why would you want to risk having a pregnancy where the unborn child is being exposed to mercury? Because that mercury goes through the mother's bloodstream, goes into the placenta, and because the fetus is growing, mercury accumulates 4 times or 4-fold what it does in the mother's body. Number 5, mercury affects our hormone levels. So there are things going on where the damaging effects of mercury, it's just not limited to your brain and your kidneys. It's going to affect the adrenal system as well. And once it's absorbed into the bloodstream, there's been 5 consequences that have been observed. It accumulates in organs that regulate hormone function. It damages the tissues of these organs. The hormonal concentrations change, and it specifically interacts and affects the sex hormones, and it also affects enzyme production, which you need to generate biochemical processes in the body to make your hormones get there. So these aren't the only problems. Testosterone and mercury combine to create a toxic neurochemical. Now, estrogen appears to have a reducing effect on mercury and may offer some degree of protective effect. Researchers have explained that researchers suggested that this might explain the difference between the way autism affects boys and girls. So it's quite fascinating, the effects of mercury and what's going on for us. We're told these fillings are safe. Dentists still use them. Dentists are still trained to use them and told that it's okay. They're then exposing you, the patient, their team, and also themselves occupationally to mercury every day. And, it completely horrified me that once I kind of started knowing more about this, that I look back and I'm like, I was 19 years old, working with amalgam, being trained as a young dental student, and I was told this stuff was safe. I even questioned, what happens when we drill out mercury, and I was told, don't worry about it, your suctions that you use, get it. It's not the truth. And so we've got a profession dentists who handle amalgam fillings have higher rates of tremors. They have neurological problems, kidney disease, higher rates of heart disease, higher infertility, depression, Alzheimer's, MS. I mean, it's not just down to the fact that we are working in a stressful environment. Our ill health problems can't just be due to the fact that dentistry is stressful. There was recently a cluster of cases in the US where dentists were dying of this lung disease where their lungs were becoming fibrous, and not once did they question, could this be from mercury toxicity? If you're concerned about mercury, you can do a detox. You can take things to help mitigate and offset mercury. But while you've got amalgam in your teeth, it is like a little tap, drip feeding mercury into your body every day, every night for the lifetime of that filling, which is going to outlast you. It's still going to be leaching mercury out long after you're gone. We've talked about mercury in the filling and what it does. So just to recap, mercury fillings leak. Mercury gets removed at the same time as the fillings. As they're getting removed, that mercury is released and you get a big exposure. We need safety precautions. Mercury is immediately toxic. It causes harm and damage straight away to the cells in the body. Mercury might be linked to autism, and mercury affects our hormone levels. So number 6, men actually are at greater risk from mercury. Mercury's effect on the DNA has also been shown to be gender specific. And a survey amongst dental professionals evaluated the impact of daily occupational exposure to mercury on the DNA. And they found that the greatest negative impact on the DNA function occurred in men. Again, I wonder if this comes back to the testosterone and estrogen components. Fact number 7, mercury harms the thyroid. Now, something I've noticed in my own practice over the years is when we take a medical history, the amount of people who have thyroid issues, particularly women. Now, I studied about Hashimoto's thyroiditis when I was a student. I remembered the name really well because it's just one of those words that I liked, Hashimoto's thyroiditis. And it wasn't until probably 15, 16 years ago that I'd ever come across somebody with Hashimoto's thyroiditis. But in the last 10 years, almost 1 in 3, 1 in 4, particularly female patients who are coming to see me, have got this autoimmune condition of the thyroid. Now, is that because we're better at diagnosing it and picking up the symptoms? Maybe. Or is it because we're seeing a higher prevalence? And so for me, there's 2 issues here. Fluoride and mercury affect the thyroid gland. Now, we live here in Brisbane in a fluoridated area. It's in our water supply, and you've got amalgam fillings in your teeth. It's kind of like the perfect storm for damaging the thyroid. So what they did is they examined women. About 75 women were evaluated for the impact of mercury exposure on their thyroid function. They also looked at the offspring of these women, and their study was from, prenatal to a postnatal period. And what they found is that they identified low levels of mercury from amalgam fillings and diet and so forth. And they looked at the impact on the hormone, on the thyroid hormone levels. And they saw that women who had amalgam fillings, the offspring had impaired thyroid function. And a healthy thyroid is vital for healthy development. It's particularly crucial for neurological function, and damaged thyroid causes cretinism. And this should be a red flag for any woman who's intending to have children and has amalgam fillings. It's something to seriously consider. When you're pregnant, ladies, they tell you not to eat tuna. And the reason they tell you not to eat tuna is because of the mercury content. Should they not also be telling you not to get amalgam fillings placed, or not to have them drilled out, or not to have amalgam fillings at all? Ironically, fact number 8, mercury fillings affect your oral health. They are toxic to your mouth tissue. So your gums, your cheeks, your tongue, those fillings are, constantly in contact with them, and it's toxic. So it analyze, if we analyze the cells from inside the mouth of men and women, and we rule out other factors like alcohol and smoking because they're obviously very bad for us as well. They showed that those with amalgam fillings had cellular and DNA damage inside their mouth. Another study linked burning mouth syndrome, mouth ulcers, and white patches, and changes in the skin and the texture inside the mouth with the presence of mercury fillings. And I've seen this myself. You look around somebody's mouth and it's perfectly healthy. It looks pink and beautiful. And then you get to where there's amalgam filling, and the cheek and the tongue are patchy, they're red, inflamed, and there's things going on that shouldn't be going on. We remove the amalgam fillings, and in a lot of cases, those areas of concern simply disappear. Mercury amalgam is dangerous to children. So children are smaller than us, they're developing quickly, they're growing, their brain cells are increasing. And an ongoing study reported that children with mercury fillings have increased levels of mercury in their body, and that level of mercury in the body is growing year after year. And the control group, which was the group that didn't have any fillings, did not show this rise in mercury. So again, the research is showing that mercury fillings are causing mercury buildup in the body. The biggest fact is that, you can say, well, maybe they don't know, maybe they're ignorant. Medical officials are aware of these issues. They have been very aware of the dangers of mercury fillings for well over a decade, if not longer. I remember watching a documentary in 1994, not long after I'd graduated dental school, that was saying the exact things that we're saying now. There wasn't as much science to back it up back then, and it was very ridiculed, but they were saying exactly what the science is proving. So there's records that go back to 2000, 2001 that report increased levels of mercury in the liver, the kidney, and the brain in people who have amalgam fillings. Researchers have even identified it in the amniotic fluid and the placenta of pregnant women, and in the meconium, which is that black poop that newborn babies have. So it shows it's transferring from the mother across to the fetus, and the fetus is actually, the baby, once it's born, actually has amalgam levels detectable in its poo. Sorry to be so blunt. So even with this knowledge about the danger of mercury and mercury vapor, amalgam fillings are still being placed in children as young as 2. That blows my mind. We tell parents, don't let your children smoke, don't let them sit in a smoke-filled room, don't give them alcohol, don't feed them this, don't feed them that, do all the things that you need to do to give them a good start in life. Yet dentists will think nothing of sticking an amalgam filling that's 50% mercury in this baby, this toddler's mouth. It makes no sense to me, particularly when we have so many dental materials we can choose from instead. So before you or your children get another dental filling, there's something I want you to do. I want you to make sure you ask the dentist, what filling are you putting in? What material are you using? If it's a mercury amalgam, or they say a silver filling, ask, does that have mercury in it? Request alternatives. You're absolutely within your rights to do that. And if they won't, then find a dentist who is mercury-free. It's so crucial that in this day and age where we are exposed to more environmental toxins and stressors and chemicals than we've ever been before, that we take as many steps as possible to eliminate these pressures off our body. If we want to live long, healthy, vital lives, we need to take care of our body, and polluting it with poor food, emotional baggage, poor sleep, and toxins like mercury is not the way to go. So I hope you found this useful. I hope that I've shared some information, and it may be a confirmation to things that you already know. This is not new news. This is what I'm saying. 1994, this was on a very well-known program in the UK. This information was already there available. And so the dental profession have had plenty of time to look at this and to start looking at how can we make changes? How can we move away from using this product that is toxic to human health? And look, if I was to invent dental amalgam today and I went down to the agency who say, you know what, we're going to tell you whether you can use this, like the FDA, Federal Drugs Administration Agency in the US, or the TGA here. And I said, I've got this great filling material. It's awesome. You know what? I love it. It's really cheap. It's super, super easy to use. I just mix it up and squash it in the tooth and smooth the top off and we're good to go. It's hard and it's going to last a long time. Those are things that are very, very, they're the sort of thing we want in a filling material. They're very popular, hard wearing, long lasting, it's cheap, it's durable, da-da-da-da-da. But I say to them, okay, So what it's got in it is this, right? It's got silver, it's got some copper, some tin, a little bit of zinc. Oh, yeah, and we have to mix it up with 50% mercury so that it's soft enough to push into the tooth. And then it all binds together. And, the mercury is somehow magically safe once it's in the tooth. You know what they're going to say? I won't swear, but it begins with P and ends in off. They'd be like, you're insane. We're not going to put that in a human being's mouth. I mean, if I asked you to drink half a teaspoon of mercury, you'd be like, no way. I'd be locked up if I was trying to do that to people. Yet because I have a dental degree, I am legally licensed to put mercury in your teeth. Now, amalgam, I'm on a rant. I'm just going to keep going. Amalgam, when you buy it, it has a skull and crossbones on the box. It tells you it's toxic. It has warnings on there about how you should handle it, how you should open it, how you should dispose of the canister that it's in, how you should dispose of any scrap material that you don't use. Any scraps of amalgam have to be stored under chemicals in a jar so that it doesn't gas out mercury. Once that jar is to a certain level, we have to call a hazardous waste specialist to come and take it away. The same goes for any bits that we drill out from your mouth. We can't wash them down the sink. We can't throw them in the bin. They are toxic and they have to go in the jar. So why is it that all of a sudden, in the middle bit where it's put in the human being's mouth, why is it considered safe? This is just common sense logic, and dentists will argue backwards and forwards. There's a holistic branch and there's the conventional, and you should see the fights that go on in dental forums. It is disgusting. I was shocked at the level of language, the way people get personal, attack one another. There was even one forum where they took pictures of one of the dentist's kids off their Facebook page and threatened to share them across the internet if this guy didn't shut up about the dangers of amalgam and fluoride. This is insane. I want to, I don't get it. It just makes no sense to me. Why, as a caring person who cares about somebody's health, I mean, you go into dentistry because you want to help people. You want them to have great smiles. You want to get them out of pain. Why are we falling for this lie that amalgam's okay to use? Now, you ask most dentists, what's the number one factor that is important to you when you're choosing a filling material? And they're going to say, it needs to last a long time. So durability becomes number one. There is no thought about toxicity and the impact on the human being. It's just like, it's got to be hard wearing and it's got to be easy to use. It's got to be affordable and boom, done. And that's great, but we should be going, number one, it's got to be good for our health. It cannot be toxic or cause problems beyond the tooth or inside the tooth. So it's time for dentistry to start paying attention. And the only way that's going to happen is for people like you guys who are fans of our page, who are interested in this, who are concerned about this, who have had mercury fillings removed and seen changes in their own well-being, to start talking about it so that more and more and more people get to question it. I'm not here to convert anyone. I'm not here to say you've got to see it my way. What I want to do is empower people to start asking questions, to start thinking differently, to start joining the dots and go, maybe there's a different way. So Suze, what we do is we use white filling material. Now, they're a resin material with ceramic in it to give it strength. That binds to your tooth and actually helps hold tooth structure together. Amalgam expands and contracts and actually cracks and splits teeth. It's very important with the white filling materials that they're of a high grade and high quality, so they don't have BPA and any nasty plastics in them. There are products out there that are now very hard wearing and long lasting, very durable, as well as being good for health. The alternative to that, which is a bit more expensive, is to have porcelain. The great advantage of porcelain is it just lasts such a long time. It's the closest thing to natural tooth structure as possible. So thank you so much for joining me. I didn't expect that I would get so passionate tonight. But when you start looking at this, and, I was angry for at least 6 months, maybe a year, when I started researching about amalgam and started to understand the impact of mercury. And I was just looking at my own health and well-being and like, oh my gosh, these symptoms that I have, these issues that I have with my health and well-being, maybe they're all mercury. And when I got my bloods and my urine done, my mercury levels were off the chart. Now, I have never, ever, ever had an amalgam filling in my mouth, ever. And so the only place that mercury could come from is from my workplace. And so I was really mad that I was told it was safe and I was being poisoned every day and that I was sick from mercury toxicity. Now, thankfully, I was able to detox and get rid of the mercury from my body and turn my health and well-being around. And this is why I'm so passionate about what I do, because I don't want people getting sick. I want people preventing problems, and I'm big on, let's eat right, let's sleep well, let's have great relationships, and let's get rid of toxins from our body. So thank you, everybody, for joining me. Please share this. It's been so great to have you here. Thank you so much. And I'll be back, I believe, next week. Thank you very much. It's been an absolute blast. And I will make sure that I stay around. And look, what's really beautiful is a lot of people comment, thank you very much for sharing your information, Dr. Rachel. Thank you for speaking up. And, I feel it's my obligation to do so. And I know a lot of you worry for my safety, but it's all good. It's opinions, it's backed by science, so let's go for it. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for listening to the Dental Zone podcast. Thank you for all your support. But if you do want an appointment, then you can give my practice a call on 0737 201811 or hop on over to holisticdentistry.au to find out more. And our email is info@holisticdentistry.au. The Dental Zone podcast couldn't be what it is without your support. So thank you very much once again. And until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.